Are things feeling a bit different than they used to? Have you noticed some subtle changes that are perhaps a little uncomfortable to talk about, maybe even with yourself? It's something many men experience as they get older, and it can bring a sense of frustration, maybe even a little bit of worry. It's easy to brush these changes aside, to tell yourself it's just part of getting older, but sometimes those subtle shifts are actually important messages your body is sending you, especially when it comes to something as personal as erectile function. Ignoring them doesn't make them go away. In fact, sometimes it just lets a small problem grow into a bigger one. But understanding these early signs, recognizing them for what they are, often indicators of your overall health, can open the door to solutions, to feeling more like yourself, and to maintaining intimacy and confidence. It's a topic many find difficult to discuss openly, but it's incredibly important for both your physical and emotional well-being. Ignoring these signs is like ignoring a check engine light in your car. It might run for a while, but eventually, that small warning can lead to bigger trouble down the road. In this video, we're going to look at 3 specific early signs related to erectile function that urologists say men should never overlook. These aren't just about what happens in the bedroom. They can be vital clues about your wider health. They are signs that often appear before things become more challenging, offering a window to address them effectively. We'll talk about what these signs are and why they matter, not in a way that makes you feel worried, but empowered with knowledge. Because knowing what to look for is the first step towards taking positive action. Understanding these early signals can lead to better health, better relationships, and a better quality of life overall. It's about staying proactive and informed about your own body. So please, stick around and watch until the very end, because there's something we'll discuss that might just surprise you and give you a renewed sense of hope and possibility regarding your health and vitality as you age. Now, let's gently explore the first of these early signs that urologists often point to, a signal that many men might notice but perhaps dismiss as just a bad night or temporary fatigue. This sign is a change in the firmness or rigidity of your erections. It's not necessarily about a complete inability to get an erection, but rather noticing that the erections you do achieve aren't quite as firm as they used to be. Maybe they feel softer, or perhaps they start off okay, but don't maintain their firmness throughout sexual activity. This subtle decrease in rigidity is a common early indicator that something might be changing in the underlying mechanisms required for a strong erection. Think about what's needed for a firm erection. Healthy blood flow into the penis, proper nerve signals from the brain and spinal cord, sufficient hormone levels, like testosterone, and a healthy psychological state. When erections aren't as firm, it often points to issues with blood flow. The penis relies on healthy arteries to expand and fill with blood during arousal. If those arteries aren't working optimally, if they are narrowing or becoming less flexible, the amount of blood that can flow in might be reduced. This is why changes in firmness are often linked to cardiovascular health. Conditions like high blood pressure, high cholesterol, and even early stages of atherosclerosis, hardening of the arteries, can affect blood vessels throughout the body, including those crucial ones in the penis. A urologist sees these changes not just as an isolated issue with sexual function, but potentially as an early warning sign for broader cardiovascular issues. It's like the small blood vessels in the penis are the body's canary in the coal mine. They show problems with circulation sooner than the larger vessels that might lead to a heart attack or stroke later on. So, noticing that erections are less firm shouldn't cause panic, but it should be seen as a nudge to pay attention to your overall health, especially your heart and circulatory system. What can you do if you notice this? First, acknowledge it without judgment. It's a common experience as men age. Then, consider it a prompt to look at your lifestyle. Are you eating a diet rich in fruits, vegetables, and whole grains, or is it high in saturated fats, sugar, and processed foods? A healthy diet supports healthy blood vessels. Are you getting regular physical activity? Exercise is incredibly beneficial for cardiovascular health, improving blood flow and reducing blood pressure and cholesterol, all factors that impact erectile function. Even moderate activity, like a brisk walk for 30 minutes most days of the week, can make a significant difference. Are you managing stress effectively? Chronic stress can affect hormone levels and blood pressure. Finding healthy ways to cope with stress, whether it's through mindfulness, hobbies, or spending time with loved ones, is important. How about smoking? Smoking is extremely detrimental to blood vessel health and is a major contributor to erectile difficulties. Quitting smoking is one of the single best things you can do for your health, including your erectile function. Excessive alcohol consumption can also impact nerve function and blood flow. Moderation is key. Getting enough quality sleep is also vital for overall health and hormone regulation. Poor sleep can negatively affect testosterone levels and increase stress, both of which can play a role. So, if you notice this change in firmness, it's a strong signal to review these aspects of your life and see where you can make positive changes. Beyond lifestyle, this sign also warrants a conversation with your doctor. Remember, it could be linked to underlying health conditions you might not even know you have, like undetected high blood pressure, high cholesterol, or type 2 diabetes. These conditions are often silent in their early stages, but can significantly impact blood vessel health. Your doctor can perform simple tests to check for these conditions. They can also assess other potential factors, such as your hormone levels, or review your current medications, as some drugs can affect erectile function. Having an open conversation with your primary care physician or a urologist is crucial. It might feel awkward to bring up, but healthcare professionals are accustomed to discussing these matters and are there to help. They can provide a proper diagnosis and discuss potential treatments or management strategies tailored to your specific situation and overall health. Ignoring the sign of decreased firmness delays getting information that could be important not just for your sexual health, but for preventing more serious health issues down the line. Seeing a doctor isn't admitting defeat, it's taking proactive control of your health. It's about understanding the root cause of the change you're noticing and addressing it effectively, which often involves improving overall cardiovascular health. Think of this early sign as a valuable heads-up from your body, giving you a chance to make changes or seek help before the issue progresses. Addressing it early often means simpler interventions and a better chance of improving function. It's a sign that says, hey, let's check under the hood, and it's a check worth doing for your long-term health and well-being. Moving on from changes in firmness, the second early sign of erectile dysfunction that urologists highlight is a decrease in the duration of your erections. This is about how long an erection lasts, even if it feels reasonably firm initially. You might find that erections that previously lasted throughout intimacy now fade sooner, or that you lose the erection before or during intercourse. This can be incredibly frustrating and confusing. Like the issue of firmness, this sign is also deeply connected to the mechanics of blood flow, but it relates more specifically to the ability of the penis to trap blood. During an erection, blood flows into specialized spongy tissues in the penis, called the corpus cavernosa, causing it to expand and stiffen. At the same time, veins that would normally drain blood away are compressed against the outer sheath of the penis, trapping the blood inside and maintaining the erection. This veno-occlusive mechanism, as it's known medically, is essential for keeping the erection firm for the duration needed for intercourse. If this mechanism isn't working properly, blood can leak out of the penis faster than it flows in, leading to the erection not lasting as long or fading prematurely. Why does this happen, and what does it signify? Again, it can often be linked to the health of the blood vessels and the structure of the spongy tissues themselves. Damage to these tissues or the veins can impair their ability to effectively trap blood. This damage can be caused by many of the same factors that affect blood flow: high blood pressure, diabetes, high cholesterol, smoking, and aging-related changes in the elasticity of tissues. Diabetes, in particular, can affect both blood vessels and nerves, making it a significant risk factor for erectile difficulties, including issues with duration. High blood sugar over time can damage the delicate blood vessels and nerve fibers essential for erectile function. This sign of shorter-lasting erections could be an early indicator that these underlying health conditions are starting to have an impact. It's another signal that your cardiovascular system, metabolic health, and nerve function might need attention. Think of it as the plumbing not quite holding pressure. The water flows in, but it's leaking out too quickly. Addressing the root causes of blood vessel damage and nerve dysfunction is key to improving the ability to sustain an erection. What actions can you take? The lifestyle modifications we discussed regarding firmness are just as crucial here. Adopting a heart-healthy diet, getting regular exercise, managing your weight, quitting smoking, moderating alcohol intake, and controlling stress. These steps help improve the health and function of your blood vessels and nerves over time. For men with diabetes, strict management of blood sugar levels is paramount. Keeping blood sugar within the target range can help prevent further damage to blood vessels and nerves and potentially improve erectile function. If you have been diagnosed with any of these conditions, or suspect you might have them, this sign should reinforce the importance of working closely with your doctor to manage them effectively. It's a sign that encourages proactive management of chronic health conditions. Open communication with your partner is also vital. Discussing these changes can alleviate stress and anxiety for both of you. Erectile dysfunction can impact intimacy and relationships, and talking about it openly can help you navigate these challenges together. Your partner's understanding and support can make a significant difference. It also allows you both to explore different ways to maintain intimacy that don't solely rely on penetrative intercourse. Remember, intimacy is about connection, closeness, and pleasure in many forms, and maintaining a healthy sex life is about what works for you and your partner. And, importantly, just like with the issue of firmness, experiencing shorter-lasting erections warrants a conversation with your doctor. Describing this specific issue, the erection happens but doesn't last, gives your doctor valuable information. It can help them narrow down potential causes and determine what tests or treatments might be most appropriate. They might investigate further into your cardiovascular health, check for diabetes, assess hormone levels, or discuss medication options specifically designed to help maintain erections. There are effective treatments available, but the first step is understanding the underlying cause, which requires a proper medical evaluation. Don't feel embarrassed to bring it up. It's a common issue, and healthcare professionals are equipped to help. Delaying the conversation can mean missing an opportunity to catch an underlying health problem early and delay getting help that could significantly improve your quality of life and your intimate relationship. Recognizing that erections aren't lasting as long is a crucial signal that your body is giving you, prompting you to take a closer look at your health and seek appropriate support. It's a sign that says, let's work on improving the health of your circulatory system and other key areas. Now let's delve into the third early sign that urologists often mention as a key indicator not to ignore: a noticeable decrease or complete absence of spontaneous erections, particularly morning erections. Many men, especially when they are younger, regularly experience erections upon waking. These morning erections are often linked to cycles of REM sleep, but they are also a good sign of healthy erectile function, indicating that the nervous system and blood vessels are capable of supporting erections without direct stimulation. As men age, the frequency of morning erections might naturally decrease slightly, but a significant reduction or complete disappearance is often considered a potential early warning sign of erectile dysfunction. Unlike erections during sexual activity, which involve psychological arousal and direct physical stimulation, spontaneous erections are largely physiological. Their absence can indicate issues with nerve function, hormone levels, or subtle problems with blood flow that haven't yet become apparent during stimulated erections. Specifically, the loss of morning erections can sometimes point towards issues with testosterone levels. While testosterone's role in achieving an erection is complex and less direct than blood flow, it does play a significant role in libido and the frequency of spontaneous erections. Low testosterone, which can occur with age, might contribute to a decrease in these unsolicited erections. However, it's not solely a hormone issue. The absence of morning erections can also signal underlying problems with nerve pathways or blood flow that are subtly impacting function even when the body is at rest. It's like a system check that's failing. If the body can't produce an erection spontaneously when conditions are right, like during sleep stages, it suggests there might be an issue with the fundamental ability of the erectile system to engage. This is why urologists pay attention to this sign. It bypasses the psychological factors that can sometimes influence erections during wakefulness and points more directly to the physiological mechanics. If spontaneous erections are less frequent or gone, it's a signal that the physical machinery might not be operating at full capacity. If you notice this change, a significant reduction or absence of morning erections, it's another reason to consider your overall health. While a single missed morning erection isn't a crisis, a persistent pattern of absence over time is worth noting. This sign, like the others, encourages you to think about your lifestyle. Are you getting enough sleep? Sleep deprivation can mess with hormone levels and overall body function. Are you under significant chronic stress? Stress can affect hormones, nerve function, and even blood flow. Are you maintaining a healthy weight? Obesity is linked to lower testosterone and increased risk of cardiovascular disease and diabetes, all of which impact erectile function. Your level of physical activity also plays a role. Regular exercise supports healthy hormone levels and improves circulation. This specific sign, the decrease in spontaneous erections, is a particularly good prompt to talk to your doctor about checking your hormone levels, specifically testosterone. A simple blood test can determine if your testosterone levels are within a healthy range for your age. Low testosterone can be managed if necessary. However, remember that this sign can also be linked to the same cardiovascular and metabolic issues we discussed earlier. So, when you talk to your doctor about the absence of morning erections, they will likely want to do a full workup, including checking your blood pressure, cholesterol, blood sugar, and potentially discuss the health of your blood vessels. It's another opportunity to catch potential underlying health problems that are showing up first through changes in erectile function. Bringing this sign to your doctor's attention allows them to get a more complete picture of what might be happening. It helps them understand if the issue is potentially more physiological than psychological. While psychological factors like anxiety, depression, or relationship stress can certainly impact erections during intimacy, the absence of spontaneous erections is often more indicative of a physical or physiological component that needs investigation. Discussing this openly with your doctor is crucial. They can help distinguish between potential causes and guide you towards the most appropriate tests and treatments. This might involve hormone replacement therapy if testosterone is low, or more commonly, focusing on managing underlying conditions like diabetes or high blood pressure, which are impacting blood flow and nerve function. For some men, medication specifically for erectile dysfunction might be an option, but understanding the underlying cause is always the first step to finding the most effective and safe solution. Recognizing the disappearance of spontaneous erections isn't just about sexual function. It's about acknowledging a potential signal that your body's systems, from hormones to nerves to blood flow, might need attention. It's a sign encouraging you to get a comprehensive health check and address any underlying issues proactively. So, we've looked at 3 early signs that urologists say are important not to overlook: changes in the firmness of erections, a decrease in their duration, and the loss of spontaneous, particularly morning, erections. These aren't just isolated issues related to sexual performance. They are often your body's way of signaling potential underlying health concerns, most notably related to cardiovascular health, diabetes, hormone levels, and nerve function. Think of these signs as valuable early warnings. Ignoring them can mean missing the opportunity to address these underlying conditions when they are potentially easier to manage. And it can also mean letting erectile difficulties become more entrenched and harder to treat later on. The good news, and this is where that surprise I mentioned comes in for many men, is that recognizing these early signs and addressing the underlying causes can often lead to significant improvements, not just in erectile function, but in your overall health and vitality. It's not a guaranteed fix for everyone, but many men find that by adopting healthier lifestyles and managing underlying health conditions, they see a positive impact on their erectile function. Addressing high blood pressure, getting diabetes under control, lowering cholesterol, losing weight, exercising regularly, quitting smoking. These actions improve blood flow throughout your entire body, including to the penis. They also improve nerve function and hormone balance. Taking these steps doesn't just potentially restore erectile function, it dramatically reduces your risk of heart attack, stroke, and other serious health issues, helping you live a longer, healthier, and more active life. So, while the initial concern might be about intimacy, the actions you take to address the early signs of ED have far-reaching benefits for your total well-being. That's the surprising part for many. Focusing on erectile health is often a pathway to better overall health. It's a powerful motivator to make those positive lifestyle changes you've perhaps been putting off. Taking that first step and talking to your doctor is incredibly important. It might feel awkward, but remember, healthcare professionals are there to help you. They understand that this is a sensitive topic, but it's also a medical issue with potential links to significant health conditions. Be open and honest about the changes you've noticed. The more information you provide, the better they can help you. They can perform the necessary tests to identify any underlying issues and discuss all the available options with you, which might include lifestyle modifications, managing existing health conditions, medications specifically for ED, or other treatments. There are effective ways to manage and often improve erectile function, and seeking help is a sign of strength and a commitment to your own health. Don't suffer in silence or feel embarrassed. You are not alone. This is a very common issue, particularly as men age. Remember, making small, consistent changes to your lifestyle can have a profound impact over time. You don't have to overhaul everything overnight. Start with 1 or 2 areas. Maybe it's adding a daily walk, incorporating more vegetables into your meals, or finding a stress reduction technique that works for you. Every positive step you take contributes to better health and can positively influence erectile function. And importantly, maintaining open and honest communication with your partner can strengthen your relationship and help you navigate this journey together, ensuring intimacy remains a positive part of your lives. Intimacy is about connection and closeness, and there are many ways to express and experience that together. If anything in this video resonated with you, or if you've experienced similar changes, please consider this a gentle nudge to listen to your body and talk to a healthcare professional. Don't wait for the issues to become more significant. Early detection and intervention are always best. Your health is your most valuable asset, and taking proactive steps now can make a huge difference in your quality of life in the years to come. We hope this conversation has been helpful and perhaps shed some light on a topic that isn't always easy to discuss. Your experiences and thoughts are valuable, and hearing from others can create a supportive community. If you feel comfortable sharing, please leave a comment below. Let us know if you found this information useful or if you have any questions. Engaging in the comments helps others who might be going through something similar feel less alone. If you found this video informative and encouraging, please give it a like. Liking the video helps more men see it and get this important information. And if you want to stay informed about other health topics relevant to living your best life at every age, please consider subscribing to our channel. We share regular content focused on health, well-being, and making the most of every stage of life. We truly believe that with the right information and proactive steps, you can live a vibrant, healthy, and fulfilling life. Live your best life at every age.